I want to spend a few moments talking about behavioral health care issues that are arising directly as a result of the pandemic. The first thing that we want to recognize is there may be an increasing number of people reaching out and seeking behavioral health care services, not because there was an existing condition, but as a direct result of dealing with the uncertainty and the unknown of this pandemic. Number of things, not knowing how long this is going to last and how I may access care. If you're experiencing behavioral health care concerns, mental health, substance use concerns as a direct result of the stress, anxiety of the pandemic, services are available for you. First and foremost is access. We may not be able to follow the traditional ways of seeking services, i.e. walking into an office and asking for an appointment or calling for an appointment. However, access is going to be available uninterrupted through telehealth services. Reaching out, having a face-to-face meeting via telehealth services through computer and being able to share your experience and what's going on. Assessment is always a key to managing behavioral health care disorders. What we're going to want to understand specifically during this period of time of increased anxiety and stress because of the pandemic is how is that being manifest for you. So we're going to be gathering history and understanding how have things been for you in the past and how are things changed for you as a direct result of the pandemic. Because that's going to guide us and help us determine what treatment interventions we're going to offer to you, and again the ways in which that treatment may be provided. You know, classically or traditionally that may have been sitting in a therapist's office face to face doing insight-oriented psychotherapy. With the pandemic and quarantine and the limitations because of social distancing, that's going to be difficult to provide. But remember, healthcare services are essential services during this pandemic. So in the case of an emergency, which could result as a direct result of the stress and anxiety of the pandemic, are still available to you and will be occurring in the same way that they've always occurred. Reaching out for that assessment is key, and then helping us to determine what's really going on for you through the information that you provide, and then the skill sets of those providers that are offering care will demonstrate and deliver the treatment plan that's most effective for you. Remember, I'm Dr. Phil Toll, and together we will get through this.